Good morning. I'm Charles Anderson. I'm the Executive Director for Domestic Violence Solutions. I've been with DVS now for 2.5 years. I have sort of a different background than maybe a lot of others that come into the nonprofit environment. I was actually a businessman for 30 years. Had sold my business. Decided that it was time to hang up my boots in a sense. Yet I was fairly young back then. And my sister came to me one day and said that, hey, you need to do something to help the community. And I said, I did. I went to school, I got an education, and I made a lot of money. She said, no, you got to give something back. So for the last 12 years, I have spent working in nonprofits. I ran an organization called the Matrix Institute on Addictions out of Los Angeles. It's fairly well known. We have evidence-based treatment for alcohol, drug, and mental health. And then I realized that a lot of the people that we worked with were in fact victims of domestic violence. So that was sort of a natural progression for me to leave there and come to an organization like DVS. I've been here 2.5 years, and one of the things that I do realize is that we have to, and this is, I never thought about giving to the community. I always thought about giving to myself. I have never been so happy and so excited each day when I wake up to know that I'm going to be doing something to help someone else. So to me, that's really important. We need to all think about that every day, because every day I give it my all, and when I hit the sack at night, I go, God, I can't wait till tomorrow. I never felt like that when I was working in business. I did feel good though when I got the money. Okay? And by the way, USC is not in a bad area. I went there. Both undergraduate and graduate.
It's like be the Trojan thing, right?
That's why Steve is listening today.
It may not be in the most desirable area, but it is a decent area. Okay, so let me put that. What I see is maybe different from a lot of the other organizations, because what we see every day are women, men, and children that are victims of domestic violence. That means every one of them, when we see them, typically is now homeless. They are leaving an environment where they have been victimized and traumatized. And at the point we get to them, it's always drama. Because we are now dealing with, especially the children, because about 65% of our clients really are the children. They're the ones that in fact are being hurt the most. What happens in domestic violence and what happens to our community is that we are creating, every time there's a victim, an intergenerational program of more domestic violence. I grew up in an environment, I see my dad or my mom fighting, arguing, screaming at each other, hitting at each other. Guess what I believe is normal? Exactly the same thing, and I do the same thing. So part of what we need to do as a community is not only recognize that this exists, we need to make sure that we are getting the word out so people will in fact reach out for help so that we can help them. And the beauty of Santa Barbara community is that we have so many nonprofits that provide services. We have about 65 organizations we work with. A number of you are at this table. And we work as a team to provide support to our community. And so what I'm looking to find out, by the way, we have a program which is called Medical Divert. Medical Divert is someone shows up at an urgent care center, shows up at a hospital, shows up anywhere. The hospital says they're a victim of domestic violence. They contact us and say, we need you to come down and meet with this person once they're able to do that. The other thing is a lot of our partners do that. We may meet someone there at the same time that's from rape crisis, because the same victim that's a victim of DV could also be a victim of rape. So we have this program of how do we all work together so that we can take every person in the community that needs help and make sure we give them the most that we can as a community so that they can move from whatever their situation is, even if it's strictly only a health issue, and become healthy and move forward to help the community. Let me get off my box now. Thank you.
Okay, I'm Georgine Lowe, and I'm the coordinator for the Santa Barbara County Education Office Health Linkages Program. And I've been working with the program for over 15 years now. And it's actually, we have 3 different focus areas right now. All are collaborative projects and initiatives. We started with the Children's Health Initiative over 10 years ago, when Santa Barbara County was identified as having the highest percentage of uninsured children in the state of California, which shocked us all. Several of us came together and developed kind of a cross-sector approach to identifying uninsured children, and then created a health insurance product called Healthy Kids, which many of you probably know about, in partnership with CenCal Health. So we've been administering and supporting that initiative until recently in May, when the expansion of Medi-Cal to cover undocumented children created a wonderful opportunity, and we no longer needed a separate health insurance product. So we sunsetted the project, and now for the health insurance enrollment, and are looking at expanding to really focus on utilization and access issues in our community. The other one is the Children's Oral Health Initiative, which also is a partnership of over 30 agencies and providers to look at children's oral health. We've been overseeing that project for about 10 years. We have a lot of statistics that we've shared with Cottage Health over the years. They've been a big supporter. And we've initiated some prevention strategies. Also, there's a huge incidence of dental disease in low-income children in our community. We know the areas and we know the reasons, and so through the partnerships we've been working on trying to do something about that. And the other project is the Promotores de Salud, and that's about 5 years old, or maybe 6 years old. Started as a real small project with about 20 women in the community that called themselves Promotores. We brought several agencies together, kind of learn about the model, and learn about the in-reach, we call it, opportunities that model really focuses on. And it's been very successful. We created a core competencies and a training for Promotores, and now have over 250 promotores throughout the county. And we're working with several different organizations and agencies to do health literacy, everything from health literacy. We're working now on a countywide caregiver initiative supported by the Santa Barbara Foundation. It's become very successful and interesting. We work with Alzheimer's Association on that project. Anyway, those are the 3 key focus areas with the Santa Barbara County Education Office.
And what does a healthy community look like for you?
Well, our focus has been on health access. With when I mentioned the Children's Health Initiative, we've really identified some gaps in services for some of the children in our community. I think the oral health program also has been working on that. We know areas that children just are on 3-month waiting lists to get treatment, that sort of thing. So I think, and then in terms of reaching out to the Latino Spanish-speaking community, I think really engaging and understanding that community and listening, having them as key stakeholders and initiatives and the work that we're doing, I think is really beneficial to the community. So creating an engagement opportunity.
Great, thank you.
So I'm Linda Tanner, and I'm the President and CEO of Visiting Nurse and Hospice Care. I've been there about 8.5 years, and we offer home health, hospice, and personal care services, along with palliative care and some other programs. And we have the 18-bed inpatient unit, Serenity House, up right here in Santa Barbara. So I think that for us, I'm trying to think where to go with this. So that's kind of what we do. I don't know that I really need to go get too much into our services, because I think they speak for themselves: hospice, home health, and personal care. So we're really interested in keeping people at home safe. And so that's really a big piece of it. I think our aging population really want to live in their own homes as long as they can, as long as it's feasible. It's still the best place to be, and then of course at some point they do need to move out. But so we really support that and want that. And I think if I keep my visiting nurse and hospice hat on, we really want people to get access to hospice services earlier, and part of that has to do with the regulations of when you qualify. So hopefully at some point there'll be some, they'll be able to seek treatment along with getting hospice, because we're getting patients so late, so our staff really can't do the work that they need to do when they only have 3 days. And then, of course, advanced care directives is very important, and I think a healthy community where everybody has an advanced care directive before they get seriously ill, so that we're having those conversations across our community, and I know that that is starting, but we still have a long ways to go. And I think then if I take that hat off, though, I think it's bigger than that, and I think when I think of a healthy community, I just think of that people have, they have food and they have shelter and they get to remain at home, and that we as all these wonderful nonprofits in Santa Barbara, that we work together to partner and make sure that that happens. So we have so many resources here, but we don't always work in concert or know about each other. And so I think there's so many ways that we can work to really be a model community and really, keep our homeless off the streets and meet the needs of those that, with abuse issues and crisis and health issues. So I think it would be everyone has what they need to survive and have a meaningful life.
Thank you.
Thank you. My name is Carol Barnacle, and I'm with JDRF, which is known as the Juvenile Diabetes Research Foundation. However, as many of you probably know or may have met, an adult that has been diagnosed with type 1 diabetes. So we're really trying to rebrand our name, and it's not known as the Juvenile Diabetes Research Foundation, but really JDRF is what we like to go by. So JDRF, our chapter is, I report to the Los Angeles chapter, but we have a very strong foundation here throughout the Central Coast. We have support groups and a lot of outreach that goes through the tri-counties of Ventura, San Luis Obispo, and of course here in Santa Barbara. I'm in Santa Barbara, I live in Santa Barbara. And supporting and having the opportunity to work with JDRF is something that's very personal to me. I've lived with type 1 diabetes for 28 years, and I'm thriving because of the work of JDRF and what the technology that we have seen. And we're really on the cusp of making this disease much more convenient. It's a very inconvenient disease if you know anything about it. But we're having the Artificial Pancreas Project, which is probably going to come to life in the spring, which will take a little bit of the thinking out of it. But we're also working on the Encapsulation Project, which some people are calling that the cure for type 1 diabetes, which is about 15 years, hopefully, to market. We're in the very, very early stages of clinical research. But JDRF as a whole, we do a lot of work in prevention and treatment, but we do a lot of work in advocacy, which is something that's very important to me. My background before, I don't know that I said this, but my son, who's 2, was also diagnosed with type 1 diabetes. So before he was diagnosed with type 1, my background was in school counseling, and that's kind of the heart of who I am is that counseling piece. But advocacy is something very important to me because I think one of the greatest needs we have in the community is having equal access to these amazing pieces of technology. Right now my son's at school at Kellogg, and I can look at his blood sugar on my phone and see where he's at. When I go to the support groups and I meet other families, this is not something that you can get through Medicare or Medi-Cal or SynCal. And JDRF as a whole is working very hard. I went to Washington, D.C. and met with our legislators, and this happened with 200 other people just saying we need equal access for this technology because it's life-saving. And so we do that kind of as a whole organization, but I have found some movement lately with SynCal starting to approve continuous glucose monitors for people that utilize their services, and it was just through a connection of that type 1 connection, and we talked to somebody on the board, and so we've been able to have some really exciting things go on within the community. But I think a healthy community to me would be to not have a world with type 1 diabetes, but to continue the movement of making this disease a thing of the past, but equal access. Parent education is very important. Just I talked to a lot of families on the phone who were told oh, well, the school says I have to come and give my child insulin. Actually, you know, when your child's at school, the school is you know, there to support you, and let's work together with the school to make this, you know, happen. I worked with, you know, people that are working on the farm who are the fields, and they're coming, you know, in and out trying to, you know, make whatever they make an hour, and then they're trying to give their kids insulin, you know, a couple times throughout the day, and it's just something that we have to, you know, educate and work together and collaboratively with the schools, with parents, with health and insurance. It's just, it's a very complicated disease. It's very stressful. Everything between, you know, exercise and food and stress. You think of it all impacts blood sugar levels, and we try so hard to, you know, keep our blood sugars consistent, but it's very difficult to do. You know, maybe afterwards, I would love to talk to someone at Cottage about our Bag of Hope program. We just found out that is a tool that I actually used the other day. I was opening it up and said, how many carbs are in 2 slices of watermelon? I'm trying to write it out for the, you know, the school nurse, and JDRF provides this really cool Bag of Hope that it has an extra glucose meter in it because, you know, some families don't have insurance and they really need that support. It has a Pink Panther book to help kind of explain Diabetes 101 for little kids. It has a book that my son's school nurse, read to the class. He's a first grader, to explain you know, what diabetes is, so they understand why he's coming and going and someone's coming and going to see him, and why these alerts are going off. And it has measuring cups because some families don't, you know, might not have measuring cups or utilize those. But it's a really good tool that I received in the hospital after lupus was diagnosed, and we just let families, you know about our support services. We give them this, you know, extra bag. And I know there's been some transitions within Cottage Hospital and endocrinology, pediatric endocrinology, moving to Goleta, but somehow we just met with the pediatric endocrinology department yesterday, but somehow this Bag of Hope has been sort of lost in the shuffle of the transition. And so we're trying to work with them about what do we do to get this back, because we received it in the hospital, and I used it the day I came home from the hospital with my son. So anyway, it's a simple logistic thing, but I think if I was able to talk to the right person, it would be really great to bring that back to the life of our community. It's a really great tool. So,
Thank you.
thank you.
I'm Maddie Fry, Director of Population Health Evaluation. And I want to first say Elizabeth obviously is very sad to not be here today. She had a sudden event happen in her life. So hence the camera, but hence, you know, please pretend that she is here and participating with us. And she very much wanted to be here today. So population health evaluation, I won't talk too much about this, but some of you already have heard my spiel, but basically my job is to figure out what would success look like and then help us measure how we're going to get there and if we're getting there. And obviously, not an easy task considering sort of the scope of the work with population health, but what we hope to do from these listening sessions is collect a lot of data, a lot of information about what's happening in the community, what you see, which is a lot closer to the work than what we're seeing. And then combine that with other data sources, like Bob mentioned. We're doing a community health needs assessment. We're going out into the community and doing phone-based surveys. Some of you may have gotten the call from our contractor. And then kind of combine all that information into a really good sort of informative way of moving us forward into what would these population health initiatives actually look like, based on the needs, based on the strengths, based on our assets already in the community, based on sort of the urgency behind some of these issues, and be as informed as we possibly can before we go out and make a bunch of mistakes, which we know we will do. And so we're just trying to be as informed as possible, and I'm going to stop talking because this really is a chance for us to hear from you, who are kind of the experts on the ground. So thank you for joining us.
Hello, I'm Allison Conwell, and I am with Galeville Design, and we're collaborating with Population Health on their listening tour.
I'm Monica Ray. I'm in Cottage Health in the Population Health Department. I work in community outreach and community benefit programs, helping to oversee our grants programs that we make to the community.
I'm Michael Wiesbrock. I'm the Executive Director for the Arthritis Foundation Central Coast. And fairly new to the organization, just over 2 months now. So happy to be on board and happy to say that the Arthritis Foundation has made a commitment back to the Santa Barbara area by putting staff here in Santa Barbara. There are 2 of us, but it's 2 more than we used to have, which is great. We're still learning the whole process here, but our main goal is to raise awareness of the Arthritis Foundation. We're also in the Tri-County area from Ventura through San Luis Obispo, and making the community aware of the resources that are available to people that are dealing with arthritis, and making sure people understand it's not an old person disease, which I learned when I took on the job, but it affects children. We have patients that are as young as 4. They're affected with juvenile arthritis, and they can't get out of bed, they can't get into a bed, they can't go out and play. So it is a disease that affects people for a long time, and the care and the medicine's come a long way from 40 years ago when you were prescribed to take 30 aspirin a day, and that was your cure for arthritis. So raising the awareness of the research that's going on, trying to raise awareness with different healthcare providers and our rheumatologists in the area about the resources that are available to them, and get out to the patients. And what we're finding is, because the county's so spread out, a lot of people don't know what the resources are. So nationally, we've gone to a home office to centralize the resources to put online, and then people can go figure out where they need to go in their communities. By putting in 93101, I can know that there's a Dr. Cottage Hospital where they provide these services, or if I'm in San Luis Obispo, I know who to go to if I need massage therapy, or if I'm looking for a class, if I'm looking for a support group. JA Family Days are a big thing for us, to bring the families together whose children are affected, to feel like you're not alone, especially for a teenager who things to do. They can't go to school anymore. They used to be an athlete, so they can't do anything. So that's kind of where our focus is now. And as we move forward through the next year, is get back in the community and reestablish the Arthritis Foundation as the go-to resource for people in our area that need assistance, whether it's the children, the adults, or whoever, and we'll be there for them to help out.
And what does a healthy community look like for you?
Look like the Arthritis Foundation. Well, I think the long-term goal as a healthy community for us would be that we find a cure for arthritis. We're talking about we have medications now that can control the disease, and we are looking for a cure. But in the short-term thing is having the resources out there so people know where to go to. So it's not a debilitating disease anymore, that you can live with arthritis, you can be active. We say we're the champions of yes, so even if I have arthritis, I can still go play basketball, I can still be a dancer, I can still be a musician. So I can live with the disease, but I can control it as opposed to the disease controlling me, whether that's medications or other groups that are out there with diet is very important to people living with just diabetes. Diet is very important to people who have arthritis. So that's, I think, what a healthy community would be, then, and that you know where to go and you're taking the right medications and you're controlling your disease.
Great, thank you.
Good morning, everyone. My name is Mitchell Sloan, and I'm with the Alzheimer's Association. My title is Vice President of Development, and I've been with the organization on position for 5 years now. Firstly, thank you, Steve and Cottage, for sort of bringing everybody around the table. This is really profound, so thanks for the opportunity. On behalf of the Alzheimer's Association, we feel privileged to be here. In terms of, we've been in Santa Barbara for 32 years, providing services to families facing Alzheimer's in the community. We operate out of 2 offices in the North County, which we feel is extremely vital, in Santa Maria, as well as here in town on Chapala. Let's see, in terms of program services, we provide 5 core services for folks with Alzheimer's and their families. We provide information and referrals. We provide care consultations, which are sort of care planning, designing plans of care for folks. We provide support groups. They're all throughout the county. operating weekly or bi-weekly on a regular basis. We also provide safety services like medical alert, safe return for folks that wander. That's a really big issue with folks with dementia. And lastly, what I'm really excited about is education. So we have had a huge pivot in my tenure where we really ramped up our education, where we were sort of viewed as the ER, meaning the 911, and that this is everything was a crisis for our care and support team. So now with education, it's about, we have a smorgasbord of education programs, all free, by the way, of education for the PWD, the person with dementia, as well as their caregiver or caregivers, and through the 7 stages of the disease. And this is all privately supported, so we don't bill insurance or have fees and things like that for folks, and they can also get respite if they really have a financial need as well. On top of that, we've been doing professional education with the past, I would say, 18 months, meaning our first responders, healthcare professionals, and so that's been really, really profound and something that we think we need to do more of in terms of the need. Our vision is pretty clear. I love it. I can't wait to work myself out of a job. It's a world without Alzheimer's. Alzheimer's is a devastating disease and pretty horrific. I know we're getting closer, but there's currently no prevention, cure, or treatment, so it's a death sentence. It's always fatal. But on the optimistic side, as I was talking with a few of you before we started, there's things in the pipeline, so there's hope. And that's what I think really has been really moving for Alzheimer's. We work on advocacy, awareness, but that there's hope now because there are some real tangible things in the pipeline, and with research advancing now at the national level with the NIH, we're at the 1 billion mark finally, which I call it's downhill running now, because when you look at data, which is so important, they call it 2 billion. You get to 2 billion in NIH dollars, and you finally see some traction with movement of disease. And the perfect example is cancer, HIV, AIDS. When they got to that threshold, you saw some real, movement, and people didn't necessarily have a death sentence anymore. So we have a little campaign going, which I love. It's called Our First Survivor. So hence the hope, meaning that hopefully my children, their children won't have to face this anymore. So yeah, thanks for letting us be here.
And a healthy community looks like for you?
Yeah, it's pretty clear. It's everyone with a brain is at risk for dementia and Alzheimer's, so we won't have a healthy community.
How are you defining people with brains?
Back to the Trojan comment.
Can we cut that?
So yeah, it's a healthy community is that we no longer have this disease, and just, yeah.
Great, thank you.
Good morning, everyone. My name is Elena Walzak, and I'm the CEO for Calm. And I'm fairly new to Calm. I've been there about 8 months now. So, but I've been in Santa Barbara for about 15 years. Most recently, before Calm, worked for PathPoint, working with adults with disabilities. So I also bring that lens to the table when we're thinking about a community. And before that, worked at DVS, also worked at the Right Crisis Center here. So Calm, as many of you may already know, founded in 1970 by a public health nurse who happened to be married to the emergency room doctor that responded to the death of an infant. A stressed young father didn't know how to make his baby boy stop crying and shook him to death. And in response to that, this woman, this nurse, Claire Miles, put an extra phone in her home and created a warm line for stressed parents, put an ad in the paper and said, stressed parents, if you don't know what to do, call this number. And in the first month, she had 40 calls. So CALM was born before the child abuse movement really happened. And so from an extra phone line, we're now a professionalized mental health service agency throughout the county, about 100 staff, $7 million budget. So really grown in those, well, 46 years. And so our mission is to prevent, assess, and treat child abuse, but child abuse is multifaceted. So about 40% of the kids we see have been exposed to domestic violence, so we consider domestic violence exposure a form of child abuse. Many of our families have substance abuse issues and addictions, hence neglect, which also is a big issue that we work with. So we have programs in 5 key areas. The first is our Great Beginnings program, so it's a prevention and early intervention program. So we're working with children and families prenatally through age 5. And that's evidence-based home visitation programs, that's postpartum depression services, really interfacing. We know brain development in those first 5 years is absolutely essential, so we're trying to engage children and of course families as early in that process as possible. We also have a tremendous parenting program because we know that you cannot serve a child if you're not wrapping your arms around the entire family, especially at young ages. The entire world of a child is about the attachment to the adults in that child's life. So a big portion of what we do is parenting support, parenting education, parenting groups. I think CALM is known mostly for its third area of service, which is treatment, which of course we do. We're supporting children and families after abuse or neglect or domestic violence has happened, using evidence-based practices, again, a variety. We primarily use trauma-focused cognitive behavioral therapy, which is kind of the trauma approach for abuse and neglect. But so much of our work is also prevention, so that we're doing services to children and families before abuse ever occurs. We also have a program called Whatever It Takes, and that really is what it says. So that is much more intensive work with a family. So rather than your 50-minute counseling session, this can be 3 to 4 sessions a week, a few hours at a time. So we might be serving a family up to 10, 12 hours a week. And so those are often families with a pretty significant mental health diagnosis for the child, or interface with the foster care system. We might be looking at children that have been removed. Maybe there's family reunification. Maybe we're working with family treatment drug court, helping those with substance abuse reunify. And then a large component of our services is really engaging the community. So we do education in the schools, so prevention education for elementary school age children, no-go tell, so how to stay safe and what to do if something inappropriate is happening. We have a partnership with 8 preschools in Santa Barbara, so we're embedded in those preschools to provide support to those preschool teachers, but we're also doing a lot of reflective practice of really helping those teachers reflect upon their own trauma narrative, if they have one, and how that might be triggered by the outbursts or the behaviors of young children. And again, because we know brain development, we want to reach those families as early as we can. So embedding in those preschools, we're supporting the child, we're supporting the family, we're supporting the classroom, but really engaging with that age group. We're also starting, which may be of some interest, we're starting a collaboration looking at ACEs, adverse childhood experiences, and the direct connection between early childhood trauma and chronic stress and long-term health outcomes. We know that diabetes, we know that heart disease, we know that cancer, we know that autoimmune disorders have roots in chronic stress that children face. And so children that are exposed, so there's an ACE study, and so you can rate yourself on how many ACEs one has, but as the number of adverse childhood experiences go up, risk for certain later health problems skyrockets. So we're looking into how to work with the formal health community in that arena. we moved recently into Santa Maria. We've been in Santa Maria for about 6 years now. 80% of child abuse reports are coming from the North County, specifically from Santa Maria. So the need is tremendously great. So called me that its services need to mobilize more. So that's been a large undertaking for us. What does a healthy community look like? I think a community where there's equity and where there's access, where all people, all community members have voice. We know that there's a tremendous need in the Latino community for mental health services of their language and of their culture. So 65% of CALM clinicians are bilingual, bicultural. It's a tremendous need that this population doesn't have resources in their language. And I also think a healthy community is one that understands that behavioral health, mental health is integrally linked to physical wellness, and that services are connected and that there's collaboration across multiple entities.
Thank you.
Wow. Good morning, everyone. I'm Anne Marie Cameron, and I'm the CEO of the Mental Wellness Center, formerly the Mental Health Association in Santa Barbara County. Our organization also umbrellas the local NAMI chapter, which is the National Alliance on Mental Illness, and primarily they're an organization that is of parents that are advocates and caregivers. Our organization's been in the community for 70 years, and I've been with the organization almost 25. It's amazing to me how time flies. And it's interesting because our organization was founded out of the need for people who were moving back to their homes after being in institutions. And so in the 40s and 50s and 60s, families didn't know what to do with someone who was coming home from Camarillo State Hospital or other places. And so this organization wanted to make sure we had practical services in Santa Barbara. And we work in partnership with other nonprofits and, of course, the county mental health department. But what's interesting is that our organization went through our own trauma, our own evolution about 8-10 years ago when we moved to our new building on Garden Street. We had at that time the huge recession, we had growing pains in moving into our new building. And then the county mental health department was going through a pretty traumatic budget crisis. And so it shifted our whole thinking in terms of who we are and what we do for the better. And having lived through it, I would never wish it on my worst enemy, but it was perhaps the best thing that happened to us as an organization because it forced us to look at what is our purpose, how will we survive, because we had become pretty reliant on county government funds. But in doing so, we were known and primarily serving people who had already been ill for quite a long time. By the time you become a county mental health client, and even before you receive services, you may have been ill for 10 to 15 years. So many people go undiagnosed for such a long time, and the illness is taking its toll. And what shifted for us is the understanding that we simply have to move, even though we had been comfortable in our role as serving adults and their families, we had to move into the youth and prevention arena. We have been doing so in a very small way by working with schools and teaching a mental health matters curriculum in the 6th grade. And that, I'm proud to say, is now in over 30 schools in Santa Barbara and the 9th grade as well. We really believe that helping young people who seem to get it more than adults, that this is an illness to expect to see rather than be surprised to see it. Mental illness, 50% of all people who will have a lifetime case of mental illness experience their first symptoms by the age of 14. And it's usually, again, not 10 years before someone gets services. When we talk about underserved for mental health, it's interesting because it is a pervasive illness. It does profoundly affect people in the lower socioeconomic categories, but it also affects people of all categories. And what we're finding is that there's a huge impact to people who have insurance who simply can't find care. And so we see through our family services people who are selling and mortgaging their properties and homes to be able to afford care for their child because they don't qualify for Medi-Cal, of course, and Medi-Cal is the most robust mental health program And so it's really heartbreaking to see people do that and then send their child away because there's nothing here in Santa Barbara, and then bring them home, and then many times that treatment is short-lived, and people have to figure out what to do next. We host a lot of education and support groups. Our organization has a long history of advocacy. We want very much to be a partner with other organizations. The physical aspects of a person's life are impacted by mental health, but like a 70% correlation between mental illness and other chronic health diseases. And so partnering and understanding overall health, bringing that to our organization as well, and working with our clients. And let's see, I think a healthy community for us is one where people are not surprised, and they know what to do when they start to see symptoms of mental illness in their friends or their family. We're learning through all this great research that's coming out that a pediatrician could start to ask a young child simple questions like, do you hear your own name being called? Because those are the beginning signs of schizophrenia. And a simple screening question for that could be life-changing. And of course, you know, the workforce shortage is huge in this community, and I think that's another thing that we constantly try to address. The last thing I'll say is that the other issues that there is no health without a home. And so the homeless and our housing program, we added 3 new residences just in this last year through a partnership with the County Mental Health Department, and hope to do more of that. And so housing and employment are big parts of what we do, because when you have a disability, you need to be part of the community and partake in all that it has to be, or you will not have a healthy quality of life. And so that's a big part of what we do on our practical services side. And I started to say that kids get it. It's interesting, in the schools when we teach our Mental Health Matters program, they have an opportunity to write a confidential question. And inevitably, out of a classroom of 30 to 35 kids, there will be at least 1, if not 2 students that say, I want and I need help, and my parents won't let me get it. So the stigma is stronger in the parents than it is in the child. And working to the day where there's no shame and there's no stigma associated with mental illness is important, because it is a chronic disease like any other, and we don't shame people for having those other illnesses. So that's a big part of what we do as well.
Thank you.
Sure.
Good morning, everyone. I'm Christine Schwartz. I'm the Executive Director for New Beginnings Counseling Center, and I have been with the agency almost 5 years now. We were formed in 2000 from an agency that was founded in the late 1960s called the Night Clinic in Santa Barbara. And we have 5 programs, 2 that serve the mental health population, and 3 that work with housing the homeless. The first program is our foundational program, which is the counseling clinic. And we have 25 master's and doctoral level volunteer counselors who are pre-licensure. We have 10 master's and doctoral level volunteer supervisors who provide time and supervision for our counselors. We provide services in both English and Spanish. How much in Spanish depends on how many bilingual, bicultural counselors we have at the time, but we usually have at least 2. We see, we serve essentially every mental health issue, and we also provide psychological assessment at an incredibly reduced rate. We've amassed a very good battery of assessments, and those are administered by our doctoral candidates and supervised by the doctoral level clinicians. We have a life skills parenting education program that we provide in the community at other agencies, and that's in order to increase access to people who are unable to come into programs. So, at any given time, we'll have a group running at Transition House or Bill and Jello or the Housing Authority, And the classes are tailored to the population, so where it might be more oriented towards family at Transition House, it's more oriented towards, unwed, first-time mothers at Village-O, for example. And the classes are offered in 5, 6, and 8-week sessions. We have 3 housing assistance programs. The first is the Supportive Services for Veteran Families program, and that is very specifically a program funded by the VA to end veteran homelessness. We work to help people to prevent eviction, help veterans to prevent eviction, and to help homeless veterans get back into housing. We have internationally recognized program called the Safe Parking Program. It's the model program in the country for the vehicular homeless, and it's not something I created so I can brag about it. And it's just really the most innovative and interesting program I have ever seen, and it's just so unique. Where we were funded to create a best practice program manual, which is going to be published by Sage Publications, which we're really excited about. And we get a ton of attention in election years. It's very interesting. 4 years ago, the same thing happened, and we've been we just were interviewed by NPR's All Things Considered. We've been on Larry King and People Magazine and CNN and KCBT, and it just goes on. So the program provides overnight shelter for individuals and families who live in their vehicles. We operate 20 lots, confidential lot locations in Santa Barbara and Goleta. We have 115 spaces and shelter about 130 people per night. Unfortunately, we have an increasing number of families and seniors living in their vehicles, and we've had as many as 5 people, sitting up in a car at night. And it's tough because they, for a variety of reasons, they can't get into shelters, and so they have nowhere else to go. And this at least provides a safe place for them to go at night. In addition, we also work to transition them back into housing because we don't want to encourage a lifestyle of living in a vehicle. We've become very effective at doing that. And as well, we help to connect people to employment. And we do street outreach bi-weekly in order to try to reach out to newly homeless as well as people who need more connection to services. Our last program is we staff the Supportive Services Program for the Housing Authority for the City of Santa Barbara. And in that program, we actually often go into the homes of essentially anybody who has a Section 8 voucher or who is in public housing. And those are honestly some of the most difficult cases that we see because it's severe isolation, really, really severe mental illness, hoarding, physical illness that goes untreated and neglected. And I've learned all about people's right and ability to refuse medical services and the result of that. And it's some very difficult work. And I can't say enough about that. Housing Authority is a tremendous progressive organization, and I think we're smart in creating that kind of a department and to providing those services to their clients. We have a very exciting pilot project that we're literally just commencing with the Housing Authority. SENCAL provided the Housing Authority with funding for 1 year for a pilot project to increase access to newly insured Medi-Cal recipients. And so we'll be coordinating the project. I'm actually hiring this week, hopefully, our health services coordinator, and we will, there will be more about that. We'll probably put out a press release in the coming weeks about how that will look. But I can say for you for sure, there's an educational component in the communities, and it would be really helpful to be able to have representatives from each of your organizations come and provide healthcare in the areas of diabetes, Alzheimer's, and arthritis. So that's very exciting, and we're hoping that that will help to address things like people using the emergency room for, their primary care doctor, and getting people connected to services that they really need and just either don't know about or have an inability to access. So on that note, my idea and vision for a healthy community is one where we have access for everyone, for both primary and behavioral health care, but in the inevitable situations, and there are unfortunately too many, where people can't access or can't gain access as quickly as they need, that as a community, we have an agreed upon system as to how to address that gap in services while people are experiencing it, so that they don't further deteriorate and get to a point where, both the cost financially and the cost to them personally is significant.
Great. Well, thank you.